Hello, everyone. Thank you for joining us today. My name is Lauren Collins, Director of the Office of School COVID Support, and I want to welcome you to the Department of Health's training on the recently released interim guidance for classroom instruction in P-12 schools during the 2021-2022 academic year. Today, we are going to review key sections of the guidance and describe the layered mitigation strategies that are needed to continue to protect the health and safety of schools in New York State during the COVID-19 pandemic. But before we do so, we want to thank each and every one of you for your teamwork and collaboration with us over the last several months. During today's presentation, we will provide an overview of the following: review of President Biden's Path Out of the Pandemic Action Plan, ELC school reopening grant and other testing resources, interim guidance for classroom instruction in P-12 schools during the 2021-2022 academic year, and requirements for daily reporting to the school report card. President Biden's six-pronged national strategy employing science-based tools to combat COVID-19 includes vaccinating the unvaccinated, further protecting the vaccinated, keeping schools safely open, increasing testing and requiring masking, protecting our economic recovery, and improving care for those with COVID-19. Keeping schools safely open includes the provision of $130 billion in funds via the American Rescue Plan, which provides support to help schools reopen, accelerate student academic growth, address inequities, implement CDC recommended prevention strategies, and support student and educator social, emotional, and mental health needs. You can learn more about this plan by visiting whitehouse.gov/COVID plan. The ELC School Reopening Program is funded by the American Rescue Plan Act of 2021. Awards were provided to states to support school reopening efforts. In New York State, funds were allocated to local health departments and/or BOCES by the New York State Department of Health. New York City received their own separate ELC school reopening funds. Funding supports detection and prevention of COVID-19 in K-12 schools with a focus on screening testing as a mitigation strategy. Some allowable costs for this funding include support for diagnostic testing, testing events, vaccination promotion as part of testing and contact tracing activities, and costs for portable HEPA, fan, or filtration systems. To find out more information about ELC school reopening funding in your area, please contact your local health department and our BOCES. So schools operating in counties outside of New York City that want more information about participating can contact their local health department. In a few counties, you will need to contact your respective BOCES. So for Montgomery and Fulton counties, you would contact the Hamilton, Fulton, Montgomery BOCES. For Herkimer County, you will contact the Herkimer, Fulton, Hamilton, Otsego BOCES. For Madison County, you'll contact the Madison Oneida BOCES. And for Oneida County, you will contact Oneida, Herkimer, Madison BOCES. Schools operating in New York City should contact the New York City Department of Health and Mental Hygiene for more information about their ELC school reopening program. New York State Department of Health schools guidance is aligned with CDC schools guidance. Schools and school districts should review and adopt all aspects of CDC schools guidance and have the authority to implement based on their local context and with input from your local health department, unless otherwise required specifically in regulation. The decision to adopt mitigation measures should be based on local circumstances unless otherwise required in the document or other relevant guidance, regulations, or orders. Schools and school districts should revisit the prior year's school reopening plans and update them as necessary. The New York State Department of Health does not review or approve school reopening plans. The updated guidance prioritizes a return to in-person learning while adhering to multiple mitigation strategies, which include the following: vaccination, appropriate use of face masks, physical distancing, screening testing, ventilation and air filtration, and daily health screenings and temperature checks are an additional option. All school administrators must engage in ongoing communication with their local health department to determine appropriate responses based on levels of community transmission, vaccine coverage, and use of screening testing. COVID-19 vaccines are safe and effective and are a critical component of public health response efforts. All public school districts and non-public schools should support opportunities for members of the school community to access vaccination clinics in collaboration with local health partners. In accordance with the Commissioner's determination issued pursuant to 10 NYC RR 2.60, all students, personnel, teachers, administrators, contractors, and visitors must wear masks at all times indoors, regardless of vaccination status. Medical exemptions continue to apply. Masks do not need to be worn while eating, drinking, singing, or playing a wind instrument. Individuals should be spaced 6 feet apart when masks are removed for these purposes. Students should not be excluded from in-person learning in order to meet a minimum distance requirement. And now I'm going to hand it off to my colleague, Danielle Lloyd, for a few other slides.
Great. Thank you, Lauren. And hi, everyone. Glad to be joining you today. As Lauren mentioned, my name is Danny Lloyd, and I work with the New York State Department of Health Office of School COVID Support, formerly known as the schools team. So we'll move right along with our review of the guidance, and now we'll take a look at what to do in the event a student, teacher, or staff member becomes symptomatic. According to the Commissioner of Health's testing determination issued pursuant to 10 NYC RR 2.63, all students, teachers, and staff with any new or worsening symptoms must be excluded from school, and that is regardless of vaccination status. And also, given the prevalence of breakthrough infections among the vaccinated, there is no recommendation for exemption among vaccinated people. So in order to return to school, they must either provide a negative COVID test result or stay home from school for a minimum of 10 calendar days from the date symptoms started. If symptoms are improving and they are fever-free for at least 24 hours, and that's without the use of any medications to help reduce fever, they may return to school with either a note from a healthcare provider indicating the negative test result or a copy of the negative test result itself. Just an additional point here, it's important that all schools have policies in place that explain what students, teachers, and staff must do in these circumstances. Now moving on to some information on quarantine and close contacts. Consistent with CDC's guidance, all close contacts with a person who has COVID-19 must quarantine unless they are fully vaccinated. Fully vaccinated individuals do not need to quarantine after contact unless they also present possible symptoms of infection. However, they should be tested 3 to 5 days after exposure and must wear a mask indoors for 14 days or until they receive a negative diagnostic test result. All local health departments may establish and enforce isolation or quarantine orders within local communities, and that includes schools, based upon local conditions. So such things as rates of transmission or vaccination coverage, for instance. Local health departments may require that certain non-essential school activities, such as extracurriculars, are canceled when transmission levels are high and the risk of potential transmission is present. There's an exception to the guidance on close contacts in the classroom setting, but first, just a reminder of the definition of a close contact. Close contact is defined as anyone who is within 6 feet of an infected person for a total of 15 minutes or more over a 24-hour period. The exception to this is in the pre-K through 12 classroom setting, students who are within 3 to 6 feet of an infected student, where both students were wearing masks in both a consistent and correct fashion, are not considered to be close contacts. This exception, however, doesn't apply to teachers, staff, or other adults in the classroom setting. And now just a bit on testing. According to the Commissioner's testing determination, all schools must have the capacity to offer COVID-19 testing to teachers, students, and staff. Unvaccinated teachers and staff working in the school setting must participate in screening testing once per week if the school is operating in an area with low, moderate, substantial, or high community transmission rates. Schools are required to offer screening testing to unvaccinated students once per week, obtaining consent for minors when the school is operating in an area with moderate, substantial, or high community transmission rates. Schools are also required to offer diagnostic testing, and that can be either directly or via referral, and that's regardless of vaccination status and level of transmission. We won't get into all of the details on testing here because Dr. Mike Ryan from Wadsworth is hosting a separate webinar in which he'll be spending much more time delving into some of the what's, whens, and hows around testing. I encourage you to give that a watch. There's much more to be learned in regard to testing, and the technical aspects of it may seem complicated at first, but we really want to remind everybody of a couple of things. First off, don't be afraid of testing. There are experts to help with this, and they will help set up testing or carry out the testing itself. You don't have to learn all of the ins and outs. Of course, make sure that you're linking up with your local health department to sort out plans for testing at your school. And bear in mind, no one will be tested without consent. So schools will need to work through the consent process for teachers, staff, and students. And depending on the approach to testing your school is taking, it might be either a fast nose swab of the lower part of the nostril or a saliva test. So either of those might be used. And that nose swab isn't painful, and it doesn't use that longer swab that was once used that reaches higher into the nose. So we still hear quite a lot of myths about COVID-19 testing, and a lot of them are based on early days of the pandemic, back when tests were really hard to get, they were expensive, they could be painful, and the results took quite a long time to get back, but that is not the case now. So of course, just remember, we're here to help answer any questions you might have around testing, and be sure to watch Dr. Ryan's presentation. And now we'll move on to the CDC COVID-19 data tracker. I just want to call attention to this because it's really an excellent tool for schools and local health departments to use for monitoring purposes. You just select your state and your county from these drop-down menus that are here in this screenshot. And on the previous slide, we had discussed geographic areas with different transmission rates, so low, moderate, substantial, or high. And this is where you can find that information. Other than community levels of transmission, you can also find information on vaccination coverage in your county, hospitalizations, and more. So this is really an excellent tool to aid in decision-making. And now we'll finish up our review of layered prevention strategies. So far, we've covered vaccination, masks, screening testing, and now we'll just spend a bit of time on physical distancing. So I'd like to start off by stressing again that schools should not exclude students from in-person learning in order to meet a minimum distance requirement. Physical distance should only be implemented to the extent possible. But some of the recommendations are listed here, and they include a distance of at least 3 feet between all students, a distance of at least 6 feet between students, teachers, and staff, and between teachers and staff who are not vaccinated. And just a reminder that it's important to maximize physical distances as much as possible when moving through like food service lines or when eating meals. So the use of additional spaces outside of the cafeteria for seating during mealtime can be particularly helpful, such as the gymnasium or outdoor seating if available. And now just a few pieces of information around transportation. Masking is required on public transportation in accordance with CDC recommendations. All passengers and drivers must wear a mask on school buses. This includes buses operated by both public and private school systems, and masks should be worn regardless of vaccination status. And just a reminder, those same exclusions and exemptions apply. So people with medical or developmental conditions that prevent them from wearing a mask may be exempted, as documented by a medical professional. And all mask requirements must be applied consistently with any state and federal law, such as the Americans with Disabilities Act. And now in regard to sports and extracurricular activities, schools must consider mitigation measures outlined in the CDC guidance, which include such approaches as vaccination and screening testing. Screening testing is particularly important to implement for activities where there's any elevated risk, such as those involving exercising, singing, or shouting, for instance. Schools should consider screening testing of participants who are not fully vaccinated up to 24 hours prior to an event. And in areas of high community transmission, high-risk sports and extracurriculars should be virtual or potentially canceled unless all participants are fully vaccinated. Also, masks are required for indoor sports, and when that is not possible, 6 feet of distance must be maintained. So that wraps up our review of the updated guidance. And for the sake of time, we did not cover all of the sections of the guidance in great detail, and specifically did not review the guidance around ventilation and filtration. So please check out the updated schools guidance document for complete information. But now we're going to take the opportunity to just review a few slides on completing the daily school survey and reporting to the New York State School Report Card. So as per Governor Hochul's recent announcement, daily reporting to the New York State COVID Report Card has resumed. Reporting kicked off again on Monday, September 13th. All schools are required to log in and submit a daily survey between the hours of 7 and 5 on each operational day of the school year. We've received requests from many schools asking that we extend the reporting window to better accommodate school schedules. So you'll see the reporting window is now from 7 a.m. to 5 p.m. rather than 7 a.m. to 4 p.m. as it had been in the past. And just a quick note, please don't fret if you go to the report card website to check your data. Our ITS team is working to update the school report card website. And so in the meantime, survey data will be temporarily unavailable. And here are just a few troubleshooting reminders for anybody who might have some difficulty logging into the survey. So all previous login information remains the same. So far, we have had folks reach out because previous superintendents, principals, or other designees are no longer working at the school, and that's no problem. Just send us an email and let us know, and our ITS team will help you to add new staff members who are responsible for reporting. And our email address is schoolquestionscovid@health.ny.gov if you need it. And if you have trouble logging in and need to figure out what you might be doing wrong, you can click on the quick help button in the upper right-hand corner. That has some more troubleshooting tips for you. But if you just need to reset your password, you can just click the reset your password link next to that login tab. And now I'll just share a few updates to this year's daily school survey. I'm sure you all have noticed that there is no longer a distinction between on-site, off-site, and hybrid school population or testing numbers. And lab information no longer needs to be reported. There are some new questions we added, and they're specific to test type. So there's a breakdown of test type for both screening and diagnostic tests conducted. And this is meant to capture antigen and nucleic acid amplification tests under each one of those categories. So if you report a particular test under screening, you would not also report it under diagnostic. It can only be one or the other. And then, as I mentioned, there's an extended reporting window this year from 7 a.m. to 5 p.m. And just a reminder, please report data on a given test result on the day that the test result is received. So for instance, if a test was conducted on, say, Monday, September 6th, and the test result was received by the school on Thursday, September 9th, a few days later, the school will just report that test result on the Thursday, September 9th survey. So now I am just going to quickly log into our test account and walk through a few of the changes I just mentioned on the survey itself. Here is the school survey login page. You will type in your username and password here, click login. And then on this screen, you'll see you can either create a new submission, view or update a submission, or designate access to complete the daily survey. This is the button you can click if you would like to, for instance, allow another staff member or someone else in your district, maybe at another site, to be able to submit the daily survey on a daily basis. But for now, we'll just go to create new submission. And this is just dummy data here because it's the test account. So you'll click on submit report, and that will bring you to the survey itself. And you'll see in this first section here, all of the school information is pre-populated, so you don't have to worry about entering any of that. You move on to the submitter information and you'll input your title, name, phone number, and email. And then you move on to the teaching model and enrollment section. And here is where you'll select if your school is in-person, remote, or hybrid. You move on to this next section here and you'll see this is where you enter your total school population. And this is the section that in the past was broken down by onsite, offsite, or hybrid, and it is no longer. So you will just enter your total number of students enrolled, number of teachers, and number of staff. And then on to the number and type of COVID tests conducted. So in this section, you'll see the changes that I had mentioned, the distinction between screening tests and diagnostic tests, and then the breakdown between antigen and nucleic acid amplification tests under each one of these categories. The definitions of screening and diagnostic tests are up here in case you forget. And right here, you'll see that just a reminder, antigen and nucleic acid amplification tests, for instance, PCR tests, may be used for either screening or diagnostic purposes. So you'll just complete the number of students, teachers, and staff for each one of those subsections. And then you move on to the new COVID positive data section. And this is where you will either click, yes, I have COVID positive data to report, or no, I do not. So when you click yes, you'll see this section pop up on the number of COVID positive individuals since last report. And that's where you'll enter the total number of students, teachers, and staff since last report. Now, if you selected no, you just would not see that section and you would carry right on to school closings. So in this section, you'll probably remember this from last year. You can enter when your school will be closed, and indicate either if it was closed yesterday or if it will be closed tomorrow due to reasons unrelated to COVID-19. So for instance, for holidays. So you can indicate that information in those sections. And then you can also list dates here during the past 2 weeks that your school was not in session. And so that's excluding weekends, but that's a great place to input information on, say, spring break. And then the last section here is on temporary closings. So this is where you would select yes if your school has been temporarily closed to in-person instruction due to COVID-19. And then you would enter the date that your school closed right there. And otherwise, you would just select no, and you would submit your survey. Okay, and now this section on holiday closings, which will look familiar to you from last year. So in this section, you can indicate when a school is not in session, and that would mean it was not an instructional day or a conference day, and that would be due to reasons other than COVID-19. So for instance, holidays or religious observances, snow days, etc. So right here, you would indicate if your school was going to be closed tomorrow due to reasons unrelated to COVID-19, you would select yes or no. And if you select yes, the date pops up there. You can enter into that field. If you select no, you just carry on to the next question. Was your school closed yesterday due to reasons unrelated to COVID-19? And you could select yes or no. And the same applies. You enter the date that you would expect to reopen right here in that field. And then this next question here, you would list the dates during the past 2 weeks that your school was not in session, and that's excluding weekends. So you can enter dates right there, and you can actually add additional ones as well by clicking that green plus sign. And then lastly, this temporary closing section applies to schools that have temporarily closed due to COVID-19 related reasons. This is where you can indicate yes or no if your school has temporarily closed. If you select yes, you would enter the date that your school closed to in-person instruction. And if you select no, that's the end of the survey and you will just click submit. And that's all for the review of the school report card and the daily survey. I'm now going to hand it back over to Lauren for a few more slides before we wrap up today.
Thank you, Danny. There are a handful of resources we wanted to share with everyone that are useful for COVID-19 mitigation strategies. So the first one you'll see here is the New York State Department of Health Find a Diagnostic Test Site locator. So you can click on that link and you can search by zip code and put in other filters to find test sites located near you. In addition, there's a link here for the Operation Expanded Testing Program. So this is a federally funded program by the United States Department of Health and Human Services, which offers free testing for eligible K through 12 schools. In addition, the CDC has provided a testing for COVID-19 in schools toolkit, which is accessible at the link we've provided here on the slide. They have some great resources there for social media posts, posters, one-pagers, letters to parents, letters to students, all kinds of opportunities for resources there. For vaccination, the New York State Department of Health has a Vax to School site. So at this website, you'll find information regarding vaccinations for school-aged New Yorkers. In addition, there is some additional funding that might be available from the Office of Elementary and Secondary Education. It's the Elementary and Secondary School Emergency Relief Fund. More information can be found at the link below. In addition to the resources we just showed you, there are some other ones that are very helpful. So the New York State Department of Health COVID-19 website has a lot of resources available to you. The CDC COVID-19 website also has a wealth of information located on their website. And then, as we mentioned earlier, the ELC School Reopening Program funded by the CDC provides a guidance document for individuals who are interested in that funding. And this guidance document provides additional information about the screening testing activities provided through this funding and other allowable costs. As a reminder, if you're interested in supporting your school through the ELC School Reopening Program and are located and operating in counties outside of New York City, you would contact your local health department or applicable BOCES. And if you're a school or district operating in New York City, you're going to contact the New York City Department of Health and Mental Hygiene. Now we would like to do a brief Q&A. We've received numerous questions on the new guidance and reporting. So we're going to review a few of the most frequently asked questions with you all now. We have many essential educational individuals who are not employed by the school, but will be in the instructional environment. Examples: direct service providers, Title I service providers, special education service providers, school nurse, security guards. What is the requirement for these individuals in regard to vaccine or mandated weekly testing? Also, what about volunteers?
In accordance with the Commissioner's determination, all schools must have the capacity to offer COVID-19 testing to teachers, students, and staff. This requires unvaccinated teachers and staff working in the school setting, including all contract employees, to get tested once per week when a school is operating in one of the geographic areas that we mentioned, so such as areas with low, moderate, substantial, or high transmission rates. Individuals employed by the school must either be fully vaccinated or agree to weekly testing, and this requirement does not apply to volunteers.
The next question, we have a fully vaccinated staff. So I understand we do not need to report weekly testing as all staff are vaccinated. Is this correct?
So yes, if you have a fully vaccinated staff, and this would include all teachers, substitute teachers, student teachers, school administrators, paraprofessional staff, support staff, etc., those staff who are fully vaccinated are not required to undergo weekly testing. But please keep in mind that any staff at your school who are unvaccinated will be required to be tested weekly. Just an additional note, schools are required to offer screening testing to unvaccinated students on a weekly basis in geographic areas identified by the CDC as having moderate, substantial, or high transmission rates. And just a point of clarification about reporting requirements. So reporting requirements under 10 NYC RR 2.9 are separate from those under 10 NYC RR 2.62. So all testing that takes place should be reported pursuant to this regulation, regardless of the vaccination status of the individual.
For the section number and type of total COVID tests conducted since last report, does this mean tests conducted by our school? Does this mean tests conducted outside of school? Should this information include the number of tests per day or since the last report?
Okay, thanks, Lauren. So another great question. So this section on the daily school survey refers to the number of tests provided by the school, either within a school building or referred offsite to teachers, staff, and students as part of their screening testing program, or as a referral for diagnostic testing for anyone who might be exhibiting symptoms consistent with COVID-19. So this can also include information that's provided by parents, students, and staff for voluntary testing outside of a school setting. Schools should complete the section for any new tests since the last reporting date in order to capture any non-operational days or potentially any missed reporting days where the school was operational but may have not reported.
So the next question is, the New York State guidance is unclear if testing out of quarantine is an option. And the referenced guidance on quarantine is a somewhat outdated document, which does not include the CDC recommendation for vaccinated persons to be tested following exposure. What approach should we take?
The most recent school guidance issued on September 2nd references the CDC guidance insofar as it recommends that close contacts with someone with COVID-19 must quarantine unless they are fully vaccinated. And just to quickly review the information we shared on close contacts, people who are fully vaccinated do not need to quarantine after contact with someone who is suspected or confirmed to have COVID-19 unless they also present possible symptoms of infection. However, they should be tested 3 to 5 days after exposure and must wear a mask indoors for 14 days or until they receive a negative diagnostic test result. And furthermore, remember the exception we reviewed earlier in the pre-K through 12 indoor classroom. Students who were within 3 to 6 feet of an infected student, where both students were wearing masks consistently and correctly, are not considered close contacts. So the updated school guidance also prompts school officials, public health authorities, and other stakeholders to refer to the New York State guidance for quarantine for community persons exposed to COVID-19. That guidance on quarantine is still current, and New York State guidance, where it exists, supersedes CDC guidance. And New York State does not allow for testing out of quarantine.
Great, thank you, Danny. And thank you all for tuning in to today's webinar. Please remember, if you have any questions, you can always contact us by email at schoolquestionscovid@help.ny.gov.